Hello, my name is Bonnie Moon, and I'm going to be doing a comprehensive advanced history and physical assessment. And I have a patient who is consented for treatment, and he is a very reliable source. So, my name is Bonnie Moon. I'm going to be your provider today. What brings you in?
Need a physical for a new job, and I have like a little bit of a headache.
Okay, can you tell me about your headache? Like, what makes it worse?
Probably stress, anxiety, probably the new job.
Okay, and can you describe the headache for me?
It's like a temple pressure, I would say. Usually happens towards the late night.
Okay, and like on a scale of 0 to 10, how severe is the pain?
Like a 6 or 7.
Okay, okay. And is there anything that makes your headache better?
Sometimes I'll end up taking ibuprofen for it.
Okay.
Yeah.
And does your headache radiate?
What do you mean?
Does it radiate anywhere? Does it radiate down your neck?
No, it's usually pretty concentrated.
Okay, and when do you usually get these headaches?
I would say probably after like 10 p.m. I think it's usually just.
And how long do they last?
Gosh, I'll usually take ibuprofen to get rid of it. They usually don't like go away on their own. So.
And how long have you been getting these headaches?
I would say probably like the last 3 to 4 months.
Okay. And do you have any allergies?
No.
Okay. And do you take any medications? Herbal or pharmaceutical?
No. Ibuprofen doesn't count.
No. Okay. And can you tell me your past medical history? Do you have any medical history?
I would say just like ADHD, and haven't had too many things, too many bad. I've never gone and had like surgery or gone to the hospital.
Oh, okay, no surgery. Okay. Any psychiatric other than ADHD?
No.
Okay, great. And so now I'm going to be doing a review of systems. But first, I'm going to go over family history. Does anybody in your family have any medical conditions?
My father had some pretty bad, like, heart infections and whatnot.
Okay.
My grandfather had skin cancer pretty bad. He had lung cancer as well. It spread to the lymph nodes. Yeah.
Okay. And where do you live?
I live in Los Angeles, California.
Okay. What's your education?
College graduate.
Okay, great. What are your hobbies and interests?
I like watching movies and TV, a lot of like entertainment. Yeah, I would say that's pretty much the only time I have really for hobbies right now.
Okay, what's your family situation?
I have a sister that lives here in California, but most of my family's back in Florida.
Oh, okay, so you're living on your own. You have a roommate?
Yep.
Oh, okay, wonderful. So you can you afford health care?
No, that's kind of another reason why I should have this new job.
Okay.
So
Great. Well, I hope I can clear you out today.
Yeah.
And get you going. Any tobacco use?
No.
Okay, great. Any alcohol use?
Yeah.
Okay. How many drinks do you drink per week?
Per week? Probably, I'd say maybe 1 a night. So I would say probably maybe 5 a week, maybe.
Okay. Great. Any illicit drugs? Cocaine,
No.
meth, heroin?
No.
Okay, great. So have you had any weight changes recently?
No.
No? Any weakness, fatigue, fever, shortness of breath, dizziness?
Fever. I would say maybe just the headache. I wouldn't say it's like fever, like I'm not like running a high temperature,
Okay.
but yeah, it's just kind of like.
Okay. Well, how about your skin? Any skin issues, rashes, lumps, sores, itching, dryness, color changes?
Dryness.
Change.
I think it's the humidity.
Okay.
Yeah.
Changes in hair, nails?
No. Just
No.
growing.
And other than your headache, have you had any head injuries or do you have any dizziness?
No.
Any issues with your eyes?
No.
Like vision changes? Do you wear corrective lenses?
Oh, I do wear contacts. Yeah.
Okay. Okay, great. When was your last eye exam?
It's probably about 2 years ago, to be honest.
Okay. Any pain, redness, excessive tearing, double vision,
No.
any blurred vision, scotoma?
Late at night when I tend to get like the headaches, I would say probably a little bit of blurred vision there. But I think it's just from wearing the contacts all day.
Okay. Any hearing changes?
What was that?
Hearing changes?
Yeah.
Any ringing in your ears, earaches, infections, or discharge?
Mm-mm.
And how about your nose? Any cold, congestion, discharge, itching, hay fever, nosebleeds?
No.
No? Okay. And your throat? Any bleeding gums, dentures, or
A little bit of bleeding gums, like when I floss,
gingivitis?
but
When was your last dental exam?
it was about 4 months ago, and they
Okay.
pretty much said the same thing. Just need to be flossing a little bit.
Okay.
More.
Any sore tongue, dry mouth, sore throats, or hoarseness?
No.
Okay. And how about your neck? Any lumps, swollen glands, goiter, pain, neck stiffness?
No.
Okay. Swollen thyroid?
Mm.
No. Okay. And on your chest, your breast, any lumps, pain, discomfort, or nipple discharge?
No.
Okay, and how about your breathing? Are you having any cough, any bloody spit, coughing up bloody spit, shortness of breath, wheezing,
No.
any breathing pains? Okay, good. Any cardiac issues, heart issues, chest pain, discomfort, palpitations? Do you get any shortness of breath or dizziness when you stand up quickly?
No. Occasionally, sometimes maybe if I get up like a little like early, but I figure that's probably just because I'm tired. But...
Any swelling in your legs or
Oh, no.
anything? Okay, how about your GI, your belly? Have you had any appetite changes, stomach problems, any jaundice, nausea,
No.
throwing up, like problems with eating or a lack of appetite, heartburn, pain?
I think I don't really have like the biggest appetite, but other than that, I would say it's nothing new.
Any burping or gas?
Might get normal like from carbonation.
And
but
any changes in your bowel movements?
No.
And how many bowel movements do you have per day?
Probably like 2 or 3.
Okay.
After I usually eat.
Okay. Any blood in your stool or
no.
dark stool?
Mm-mm.
No. Any hemorrhoids,
No.
constipation, diarrhea,
Mm-mm.
food intolerances?
No, not really.
Okay. Any issues with your urination, frequency, incontinence, dribbling? Can you not? Do you accidentally pee yourself or
Not yet.
blood in your urine?
No.
Like waking up in the middle of the night? Okay. And how strong is your urine stream?
Pretty constant.
Pretty strong?
Nothing.
Strong
out of
flow?
the ordinary. Yeah. Oh yeah.
Do you have any hesitancy or dribbling?
No.
Okay. Are you sexually active?
Mhm.
Okay. And a heterosexual or homosexual partner?
Heterosexual.
Okay, great. You have vaginal sex?
Mhm.
Okay, great. And satisfying?
Mhm.
Great. And do you guys use birth control methods?
Mhm.
Which ones?
Condoms.
Okay, great. And then any HIV exposure?
No.
Okay. And your penis, do you have any sores or discharge from your penis? Okay. Any testicular pain or masses?
No.
Okay, wonderful. Any issues with your legs, cramping, varicose veins, like the little veins on your pain, or leg pains, blood clots? No. Any musculoskeletal issues, muscle joint pain or joint stiffness?
No.
Okay. Any nerve issues like dizziness, seizures, weakness, paralysis, numbness, tingling, tremors, involuntary movements?
Nothing out of the ordinary.
Great. Any issues with your blood, like histories of anemia, bruising, bleeding, blood transfusions?
No.
Great. Any hormone issues or like heat or cold intolerances, excessive sweating, excessive thirst, excessive hunger,
No.
excessive going to the bathroom, peeing?
Mm-mm.
And do you have normal glove and shoe size? Yes.
Yes.
Looks normal. Any psychological, any nervousness, anxiety, depression, memory changes, or suicide attempts?
A little bit of that, just anxiety. Nothing on the suicide or depression. I don't think, but
Okay. Thank you very much.
no problem.
Okay, so since I already introduced myself to the patient. I washed my hands. I'm explaining the procedure. I'm going to be doing a head-to-toe assessment for you for your physical. And if there's any pain at any time during the examination, please let me know. Okay. Here we go. And so they already took the vital signs, and your vital signs are normal. Wonderful. And so I'm just going to look at his general appearance, the way he's dressed, his posture, his stature, his odor, his hygiene, his color. Everything looks great. And so now I'm going to move. I'm going to ask you, have you had any weight changes for your health status? No. And so, what are your health maintenance routines?
Like what would you say?
Like, what do you do to maintain your health?
I mean, I'm not really active exerciser.
Oh, okay.
I mean, occasionally I'll go hiking and whatnot,
Oh, okay.
but I'm not like, I don't do something like every day. I don't
Cool.
go to the gym, yeah.
Okay, well, maybe you can increase that.
I should.
Okay, so now I'm going to look at his skin color, his temperature, moisture, the elasticity, the turgor, and hair distribution. I'm going to look at his nails. I'm going to look at the shape, the contour, the color, and for clubbing. And I'm going to do capillary refill, and I'm going to check all fingers and toes. And I'm pressing down for it to see if it refills in less than 3 seconds. And for the purposes of the exam, I'm only going to do it on one side, and I'm not going to test the other side so that we have enough time. Okay, great. And it's less than 3 seconds. Beautiful. Okay, now I'm going to be doing is looking at his hair on his head, looking at the distribution and texture.
Sorry, that's just me.
That's my dog. Palpating the scalp, looking for lumps or lesions, masses, and any pain. No.
All good.
Okay.
All good.
Okay. Now I'm going to be palpating your sinuses and the frontal, ethmoid, and maxillary. Any pain? No. Now the temporal mandibular joint, open and close. Okay, that's cranial nerve 5. Wonderful. Okay, so now I'm going to be looking at your ears, looking for patency, checking your eyelids, and the sclera, the conjunctiva, the cornea, the iris, the pupils, and it looks pink and moist. The sclera looks white. Wonderful. And so now I'm going to be looking at your, I'm going to be palpating the mastoid as well. Any pain?
No.
Okay, cool. All right, now we're going to be doing is we're going to be looking at your eyes. And so now I'm going to be looking at your pupils, checking for, first actually, the extraocular eye movements. So follow my pen light.
Okay.
This is cranial nerve 3, 4, and 6, and it is intact. Okay, and so look at my finger.
Mm-hmm.
Now look at this finger. Great, and so his pupils did get bigger as he went further away. It's wonderful. Okay, now I'm going to be looking at your pupils, perla. They're reactive to light, and looking at direct and consensual, and I would do it on the other side as well. As I'm looking over here, great. Okay, and accommodation. Okay, look at this finger.
Mm-hmm.
Oh, I already did that. Okay, peripheral, that's right. Tell me when you see my finger.
Okay. Mm-hmm.
Wait, here we go.
Mm-hmm. Mm-hmm.
Okay, great. Peripheral vision is intact, which is cranial nerve. Actually, it's not a cranial nerve, just it's intact. Okay, and so now I'm going to be looking inside of his eyes with the ophthalmoscope. Okay, and I'm looking at the retina. It's red, and looking at the back of the fundus, looking at the disc margin, and it is sharp. and there's no, the retina looks normal. Okay, wonderful, thank you. And I look at both sides. Okay, so now I'm going to be testing his, looking at his ears and checking both sides, the pinna, the placement, the symmetry, and the external canal, and it looks pink. And looking at inside his ear, looking at the external canal, looking great. I see it opaque and I see the light refraction, and it's a little bit gray. That's good. And the out ear canals are pink. A little bit of cerumen. Not bad though. Okay. And now assessing your hearing. This is the Weber and the Rhine test. And it's cranial nerve 8. Tell me if you hear it on both sides. Equally. Yeah.
I feel like it's a little bit more on this side.
Okay.
Yeah.
Tell me when you stop hearing this.
I don't hear it. I don't hear it.
Okay. And it is a 2-to-1 ratio. Bone conductivity is more than air conductivity. That is normal. Okay. Now I'm going to be looking inside your nose. Okay.
Good luck.
And I'm looking for patency. Great. Looking at the septum, it is intact. And the mucosa is pink, and the turbinates look pink. They look good. All right, everything looks great. Sorry about that. Now I checked the other side as well. Sorry about that. Okay. Okay. So now I'm going to be looking in the mouth. I'm looking at the oral pharynx. Looking at the mucosa. It's pink. The tonsils are about 2+ in size, I'd say. Take your tongue out for me. Okay, great. Now move your tongue to the left, to the right, in a circle. Great. So that is cranial nerve 9 and 11, and they are intact. Okay, great. Is that, let's see. I'm sorry. Cranial nerve 9 and 8, 9 and 11. And gag reflex. That's right. I'm going to be eliciting the gag reflex, and you go. Okay, so that's cranial nerve 8, which is intact. I think I'm getting that mixed up, but okay, we're moving on. Okay, and palpating the neck now, lymph nodes, lumps, bumps, and everything feels normal. Looking at symmetry of the neck. Okay, wonderful. And push against my shoulders.
This one?
Up.
Oh, oh.
Cranial nerve 12 is intact. Okay. And so now I'm going to be feeling the thyroid. I'm going to have you lean back for me. Okay. Now I want you to go ahead and swallow. Great. Okay. Good. Okay. And so it is not enlarged. I don't feel a goiter. So now I'm going to be looking at his chest with shape and symmetry. I'm going to be auscultating his lung sounds. And this, for the purpose, I'm not going to have him breathe. I'm just going to get through it. I'm going to look this way and breathe it, but we're going to pretend. 1, 2, 3, 4. Okay, great. Okay, now go ahead and stand up for me. Looking at his AP diameter. Okay, and it looks symmetric and it looks normal. And so looking at his posterior chest, and it looks symmetric and normal. And so I'm going to be doing respiratory excursion. Take a deep breath for me. Here we go. Respiratory excursion. Take a deep, can you see it? Yep. Take a deep breath. In and out. Okay, my hands move symmetrically. Now we're going to be doing, take a deep breath and hold it in. Diaphragmatic excursion. Okay, and blow all the way out and hold it. Okay, and it is between 3 to 5 centimeters, which is normal. Now we're gonna be doing tactile fremitus. So I'm gonna have you say 99.
99, 99, 99, 99, 99, 99.
Okay, tactile fremitus is equal vibrations on both sides. I'm gonna be checking for CVA tenderness now.
Sure.
Any pain?
Nope.
No? Okay. Now go ahead and bend down and touch your toes. I'm looking at for the spine, feeling the joints, looking at the alignment. Any pain?
No.
Wonderful. Okay, go ahead and have a seat again. I'm going to be doing your heart. Go ahead and lay back. There we go. I'm going to go ahead and put your chair back for you.
Sure.
Okay.
Good.
And I'm going to be auscultating with the bell and the diaphragm. But for this, I'm just going to be using the bell. Okay, we have the carotid, pulmonic, herbs, tricuspid, and mitral. Okay. All right. And now I'm going to be doing the carotid pulse. And checking the other side. And for rate and rhythm. Listening to the carotid for root with a bell. And I don't hear any. Great. Fifth intercostal space, mid nipple line, and listening for the point of maximal impulse, and I feel it. Wonderful. Now I'm going to be doing your pulses, and I'm going to be checking both sides and comparing the brachial, radialis, the popliteal, the tibial, and the dorsalis pedis. Great. Okay, and so that is done for cardiac. And then I'm going to be looking at his abdomen. Go ahead and lift your shirt up for me. We're going to listen. We're going to look, listen, and feel. So we're looking at his abdomen for any scars, lesions, striae, vascular changes, rashes, any color. I'm going to listen with the diaphragm in all 4 quadrants for 1 minute in each quadrant, listening for vowel sounds. For hypoactive, normal active, and hyperactive. Great. Now I'm going to be listening to his aorta for any bruit, and his iliac arteries for any bruit, and his femoral arteries for any bruit. Okay. And now I'm going to be doing light palpation, and tell me if you have any pain.
No.
Okay.
No.
No. Okay, now tell me, or I'm just going to listen. This is tympanic, tympanic, tympanic. Okay, great. Okay. Now I'm going to be feeling where his liver is, and it is 1 centimeter below the costal margin, which is normal. Okay, so I'm palpating the liver, and there we go. All right. Now we're going to be doing Murphy's sign, where I'm going to have you take a deep breath. Okay. All right, and there's no cholecystitis present, otherwise he would have pain. And now I'm going to be doing so that was a Murphy's sign. Oh, excuse me, that wasn't Murphy. That was, yes, that was a Murphy sign. Now I'm going to be doing the aorta. And the aorta is less than 3 centimeters. And it is just lateral on the left to the umbilicus, and which is normal. Okay, and now I'm going to be doing the obturator sign. We're going to be checking for appendicitis or any problems with the appendix. Any pain? Okay, now go ahead and roll onto your left side.
Like this?
Yep.
Okay.
And tell me keep this leg straight.
Sure.
Any pain?
Nope.
Nope. Okay. So if he had any problems with his appendix, he would say ouch. And that was the psoas sign. Okay, and go ahead and get up for me.
Okay.
Thank you. Okay, so now we're going to be testing cerebellar function. And I want you to close your eyes and put your finger to your nose on each side.
Okay.
Boom and boom. Good. Now rapid alternating hand movements on your lap. Yep.
Eyes closed? Or?
Great. Oh, you're good. Feet together, eyes closed, arms out,
Which way?
front.
Okay.
Okay, I'm going to lightly touch you and try to maintain your balance.
Okay.
Okay, good. So his cerebellar function is intact. Now we're going to be doing some walking.
Okay.
So I want you to go ahead and walk that way
All right.
over to the file
Just
cabinets.
normal?
Just normal.
Okay.
I'm looking at your gait. And he's steady. And now I want you to walk on your toes this way.
Like this?
Great. And now back on your heels.
Backwards? Or?
No, the front.
Oh, like this?
Yes.
Okay.
On your heels. Wonderful. Good. Okay. Now tandem walking.
How's that?
Like you're
Oh, gotcha. Just in a straight line?
Yep.
Okay. Do I have to look forward or?
you're good, you're doing fine.
Okay.
Okay, now shallow knee bend.
How do I do that?
Just like this.
Oh, okay.
Any pain?
No.
Okay, wonderful. Okay, now go ahead and sit back down. We're going to be doing now we're testing pain and soft touch.
Oh boy. Okay.
Tell me if you feel pain or dullness. Close your eyes.
Okay.
Okay.
That was dull. That felt dull.
That felt good?
That's sharp.
Okay.
Yeah.
That?
Dull.
Okay.
Sharp.
Yeah.
Dull, definitely. Sharp. Dull.
Okay, and I do it to the other side.
Ooh, sharp. Dull. Sharp. Dull. Ooh, sharp. Dull.
Good job.
Okay.
Okay.
Sharp always gets me. Like, ah.
Now we're going to be doing vibration.
Okay.
Okay. Here we go. Close your eyes.
Oh, okay.
Tell me if you feel it. I'm going to test both sides, but for this, just one.
Okay. I do.
Okay, and then we test that side.
I do.
Okay, and then we test that side. Okay. So, now I'm going to test reflexes.
Okay.
Okay.
Eyes open.
You're fine. Yeah. I'm going to be doing the tricep. Okay, great. The bicep. There we go. Great. Brachioradialis. Great. Now the patellar. There we go. All right. Now the Achilles. Okay. And Babinski. Okay, wonderful. Okay, so those are all of your reflexes. And now I'm going to be doing the musculoskeletal portion where I'm going to be palpating your neck, feeling the joint, and now I want to test the range. There's no pain. The joints are not swollen. Now I want to test your range of motion of your neck. So I'm going to have you look back.
Okay.
Now I'm testing the strength. Now do the same thing. Oh, look forward.
Okay.
Now push back against my hand and push forward against my hand. Okay, great. Now I'm gonna have you look right and look left. And then push right against my hand. Okay, good. And now push left against my hand. Great. Now I'm gonna have you put your right ear to your shoulder.
Okay.
And your left ear to your shoulder. Great. Now push against my hand. Same thing. And push against my hand. Great. Okay. So that finishes your neck. Now we're gonna move your shoulders. Go ahead and put your arms up in front of you and down. Now back up. Now push against my hand
Mhm.
and push against my hand. Yeah, with both sides. I'll be checking. Okay, great. Now move your arms in a circle. Great, and my arms out and push and pull. Great. Okay, and assessing the joints of the shoulder and no pain. No pain?
No.
Okay, wonderful. Sorry about that. Okay, now we're going to be looking at your elbows, feeling the joints, flex and extend. And now against my hands and push down against my hand. Yep, great. Now wrists, flex, extend. Now push against my hands and push against my hands. Great. Now circles. Great. Okay. Now I want you to open and close your fingers. Great. Now try to keep your hands open. Don't let me close them.
Okay.
Okay. Now squeeze my hands. Great. Hand strength. Okay. Cool. Now we're moving to your hips. So go ahead and lay flat.
Lay flat.
Yep.
Okay.
Okay, feeling his hips. Everything feels normal. Okay, go ahead and put your leg up,
Which
all the way up.
like this?
Yeah, and all the way down.
Okay.
Okay, wonderful. Okay, now back up again. Then against your hand, push against.
Mhm.
Yep, and push down against. Yeah, good. Okay, now knee to chest. Okay, and back. Okay, that was good for your knee. Now knee back. Now push against and pull. Okay, good. That's good knee strength. And I'm assessing the knee joints. Any pain?
Nope.
No? Okay, now we're moving on to the ankles. Okay, assessing the ankle joints, and I want you to flex and extend your feet. Yeah. Now push and push. Okay, great. Now move in circles. Wonderful. Now I want you to wiggle your toes for me. Great. Okay, wonderful. Okay, now we are going to be doing the McMurray test for meniscal damage. Okay, so what we're going to be, actually the McMurray is, yes, meniscal damage. McMurray goes like up.
Leg up.
Mm-hmm.
Okay.
We did that one. And, okay, yes. That one, there's that one, McMurray leg up. Yes, there we go. Any pain?
No.
Okay, good. Okay, now I'm going to be doing the anterior drawer exam. Okay, pulling. Just keep your bottom flat. Pulling and pushing. Okay, good. That one was for the anterior cruciate ligament. Okay, now I'm going to be doing the Apley scratch test. Go ahead and sit up. You're going to reach behind your back as far down as you can.
All right.
And he's past C7. Now reach the other way.
Okay. Like this?
Yeah. Okay, definitely past T7. That's very, very good range of motion of the shoulder. And the NT can test for shoulder problems as well. So you're going to put your hands up like this and drop it like you're emptying a can. Now push against my hands. Yeah. Very good. Now we're going to be doing the drop arm test, which tests for rotator cuff damage. So put your arms out and slowly down. Okay, wonderful. Okay, and if he were to drop the arm, it should show that there was some shoulder problems. So apprehension test, it tests for the glomerular joint. Okay, so we are putting this way, no apprehension. Okay, that's great. Now we're going to be testing for carpal tunnel. And I'm going to be tapping on the median nerve. Any pain?
No.
Okay, now we're doing the Phalanx, or the inverted prayer, where you put your hands like this, and we hold it for 1 minute, and I would have him do that. And if he would have numbness and tingling, then that would show positive for carpal tunnel. Okay, and that concludes our exam. I think you passed.